I'm actually very excited to organizing this meeting on respiratory viruses pathogenesis. Together with more co-organizer, Peter Openshaw, we are trying to put together a program in which we take what is known about the viruses, respiratory viruses, with a focus on influenza and RSV, but also in other respiratory viruses, what is known about them, what is known about the host and how the host respond to the virus, and how these responses result or not in pathogenesis or in resolution of disease, and trying to understand from the point of view of the virus, from the point of view of the host, how this process gets together and you get either disease or a good outcome. I hope that we can bring young researchers that are in this area, that are interested in either respiratory viruses or interested in immunology of the lung or interested in pulmonology, and bringing from all these different areas so they can interact together and put it in the context of disease caused by respiratory viruses in such a way that they see a broader picture and that people don't get only confined to the particular areas. So the virologists will have a better view of what is going on during disease. The immunologists will have a better view of how the viruses look like and how they may participate according to their genetic information in inducing diseases. And the pulmonologists also see how this play all together and how you get lung function being affected or not during these particular diseases. We will be pairing our meeting, which is pathogenesis of respiratory viruses, with a meeting that will happen at the same time, and we'll have also joint sessions, which is on viral innate immunity. And this is great. I think it's a great idea. There is a lot of new things that are being discovered about how viruses are being sensed and how innate immune responses participate in either resolution of virus infections or in exacerbation of disease occurring during virus infections. Respiratory viruses are also being sensed by these mechanisms, and to combine both meetings, I think is very timely, and it's going to be a great, I think, joint session. I also know very well my colleagues that are organizing the viral innate immunity meeting, Caetano Reyes-Sosa, Charlie Rice, and Kate Fitzgerald, and I'm going to be I'm thrilled actually that we are all getting together. Respiratory viruses still cause a lot of troubles. They are a major source of disease and of lethality in humans. There is influenza that is causing so much troubles, despite the fact that we have vaccines, approved vaccines, and approved antivirals. These are not good enough in order to be able to eliminate the burden that influenza causes in humans. RSV, there is no antiviral and there is no vaccine against RSV. Cause a lot of troubles, especially in immunocompromised people and in very young kids. And there are also some other viruses like rhinoviruses, coronaviruses, that are also causing a lot of disease and a lot of problems. Some of them are zoonotic, like for example the new MERS, Middle East Respiratory Syndrome virus, that is very similar to SARS in terms of genetic makeup. It's causing problems right now. It's unclear how much of these problems are going to disappear or not. It's unclear what is the reservoir. So respiratory viruses still are a major burden for human health, and I hope that by learning now a little bit better how they interact with the host in order to induce disease or not, that we will be able to come out with better ways in the future to treat these viral infections, either through immunoregulatory mechanisms or through inhibition of viral replication and targeting the actual virulence factors, either host factors or viral factors that are involved in disease. Keystone meetings to me have been always great meetings. You interact with your colleagues that you know very well, but also you interact with new people that come into a meeting that is organized in such a way that does not involve only your own community. And this is a great opportunity to interact with new people, get new ideas that will help in your research later on, and creating a fertile ground to interchange ideas, getting new collaborations, meeting new people, getting exposed to new things and not only to the particular area of expertise. I've been trained as a virologist, and actually through interactions, and some of them have been in Keystone Meetings with other people, I started actually to think a little bit in immunology, and now I consider myself more of a viral immunologist, and having the perspective to think about the host and not only the virus, I think is one of the places where I learned that this is very important was when I was young, coming to some of the Keystone Meetings that I've been exposed to.